unable to navigate foreign healthcare systems and frustrated with the level of care. Some refugees risk everything for their baby's well-being. Tamara Zaiva, a 35-year-old veterinarian, fled Ukraine when Russia launched its full-scale invasion in February 2022. She traveled with her 5-year-old son and settled in Poland, where her husband worked. However, 18 months later and 22 weeks pregnant, Zaiva returned to Odessa so she could give birth in her hometown. Despite the risks, because new life depended on it, Zaiva said, moving for a moment before cradling her newborn daughter, who was once again napping on shoulder. Due to a misunderstanding caused by the language barrier, she thought her daughter had Down syndrome and feared she would not be able to afford expensive tests. Her baby was born 5 months ago in a hospital in southwestern Ukraine at 40 weeks, weighing 3.3 kilograms. Zaiva decided to return her war-torn country from the Polish port city of Gdynia because she was unable to get help navigating a healthcare system that was unfamiliar her. She said, his son recently started school in Ukraine. Still, Zaiva keeps the children's passports handy in case they have to escape again. Anna, 30, a teacher from Kiev, also returned from Poland to give birth. She fled the war in the early days of her pregnancy because I realized that Ukraine was not safe. But in Poland, waiting times for patients are long and the level of care is inadequate. She said, he will be born in January. If the situation changes, I will consider going abroad with the newborn. The two women are among hundreds of people who returned to wartime Ukraine while pregnant, citing shortages of maternity care in their host countries. According to local NGOs and research by the New York-based Center for Reproductive Rights, it is often easier for women to return to Ukraine because of the barriers they face in these countries. Leah Hoctor, CRR's European leader, told Al Jazeera, some reasons, such as language barriers and lack of knowledge, are specific to refugees, while others, such as lack of resources or funding, are structural. Many of the interviewees pointed out that the standard of care was much lower, Hoctor said. In all 4 countries CRR examined, NGOs took action to help women. It's really easy to get lost in this system. Refugees are expected to know their way around without guidance, said Anna Ivanyi of Emma, a women's organization in Hungary. Emma volunteers sometimes escort women to appointments to protect Ukrainians from the hostility of institutions. Carmen Radu, advocacy officer for the Romanian Association of Independent Midwives, said that although health services for refugees are funded by the state, some doctors demand payment or refuse to treat Ukrainians. She estimates that hundreds of Ukrainian women have left Romania and are on their way back since the start of Russia's war. Hundreds of pregnant women have also left Poland. According to Malgorzata K,